Hello and welcome to On Target, a video series where we bring you information on long-term care issues. I'm Deborah Pacina. Today we'll discuss some new federal regulations regarding disaster preparedness. With me is Jason Belden. Jason's with the California Association of Health Facilities and he manages their Disaster Preparedness Program. Thanks for being here.
Hi Deborah, thanks for having me.
These new regulations, they require that skilled nursing centers conduct an emergency preparedness exercise with staff and with partners. Why is this important?
There's several reasons. First and foremost, it's always about the safety and well-being of residents and staff. Secondly, it'll help you, identify gaps and deficiencies in your existing emergency plans. It'll also allow you to work with your emergency partners like EMS and things like that. And in the end, providers are going to be required to show proof that they have conducted the appropriate exercises.
Who exactly is affected by these new regulations?
A lot of provider types, 17 in all, but today we want to focus on skilled nursing facilities and intermediate care facilities. You can find a summary for these providers in the new requirement at CAHF's Disaster Preparedness website.
What's the timeline for the exercises to be completed?
Well, since the new requirements are in effect already, facilities will need to have conducted 2 exercises by November 15th of 2017. However, if a facility has had an emergency that required them to activate their emergency operations plan, it's exempt from the full-scale exercise requirement for up to 1 year following the actual event.
So you mentioned that a facility has to participate in 2 exercises per year. What exactly is required?
Well, first, facilities will be required to complete at least 1 full-scale community-based exercise. If a community-based exercise is not possible, the facility should conduct their own and document why they couldn't participate. This documentation should include what agencies and/or healthcare coalitions that the provider contacted and the specific reason why the full-scale exercise was not possible. In addition to the full-scale exercise requirement, there's a requirement to have another exercise that can be either a full-scale exercise or a tabletop exercise. At the CAHF website, we have a number of examples of both facility-based and tabletop exercises.
So we know what exercises need to take place, who needs to do them, when they need to be done. The big question is how. Can you run through what a full-scale community-based exercise looks like?
Well, the first thing they want to do is facilities or providers should look at the community to see who might be organizing a local full-scale exercise. This could include their county emergency office of medical services, the county public health, or the city office of emergency services.
Anybody else that could be considered?
Yes, another important group to consider is the local healthcare coalition. This coalition is a key alliance of healthcare providers who have joined together for emergency planning. So facilities should contact these groups to see if they have scheduled any local community-based exercises that they can participate in.
That sounds like a good idea. But this sounds also like a really huge undertaking. Can you take us through the process?
Absolutely. The first element in this process would be the planning and designing. It is best to create a planning team for the exercise, and doing so will allow for multiple perspectives and an even delegation of any work. This planning process can be broken up into 7 steps. First, you'll need to assess your facility's needs. This means identifying what areas of your plans and procedures require exercising, and then you'll recognize which staff are in need of training. Determine if your emergency plan updates that you've done before have been tested, and then look to your hazard vulnerability assessment.
Okay, hazard vulnerability assessment. What is that exactly?
I know, it's a mouthful, right? So, the HVA or hazard vulnerability assessment, that's a part of your risk assessment. This is part of the new requirements that CMS requires. This assessment looks at the most likely and dangerous events that would force you to implement your emergency operations plans. You can find an example of this on the CAHF Disaster Preparedness website. Then the second step is determining the scope of the exercise. And this is where you see how big you want the exercise to be. Who do you wish to include and how long are you wanting it to last?
How much time should you set aside?
A minimum of 4 hours for the exercise. Moving on to writing goals and objectives. In this step, you should be asking yourself, what am I trying to accomplish with this exercise? An example of a goal would be, this exercise is designed to provide feedback on emergency evacuation operations including the ability to work with local partners in the relocation of residents during an emergency event. Now, if you choose multiple goals, be aware of your time constraints, as more goals will mean more work.
What's the difference between a goal and an objective?
Well, objectives support the goal. Their description of the performance you might expect out of the participants or the ideal outcome from their actions. Something to utilize when setting objectives is to use the SMART concept.
Tell me more about SMART.
So SMART is just an acronym, and it stands for specific, measurable, achievable, realistic, and time-based. These are great tools to help you set objectives. Now, once you have your goals and objectives, you're ready to create an emergency scenario. This is the fun part. This is a storyline for the emergency. You should provide details like weather and time of day, staff and resident status, and of course the event that causes the emergency itself. Step 5. Now this is where you determine logistics. So this includes figuring out the date and times within the facility that the exercise will take place. If anything is needed for the exercise, now would be the time to make arrangements to get them. Anyone that will participate outside the facility, like volunteers, should be contacted as well. Once you've done so, the next step is to invite those you want to participate. So you'll need to choose at least one evaluator for the exercise who will watch and record if goals and objectives for the exercise are being met. You'll also need an exercise leader who coordinates the whole thing. Finally, you're ready to gather materials. Generally, you want to create a situation manual, which includes almost everything about the exercise. In this would be things like goals and objectives, rules of play, assumptions, and the exercise schedule. Putting this all together may seem challenging at first. It's a lot to ask, but there are many examples available online for free. Some additional items needed would be evaluation tools and participant feedback forms to collect input from those who are playing in the exercise.
Okay, we've covered planning and designing the exercise. What comes next in the process?
Now's the time to actually conduct the exercise. On the day of, the exercise leader will coordinate the activities of the exercise, and they'll make sure that all participants have received their proper instructions. Then when all is ready, they will signal the start of the exercise. This can be either verbal or an electronic communication like a text. Now, when any event happens, the first thing you want to do is ensure the safety of the residents and staff. And this may include search and rescue, first aid, even a simple check on well-being. Once staff is checked on the residents, the administrator initiates the emergency operations plan.
When you initiate the emergency operations exercise, this is more than a simple drill, right?
An exercise is actually designed to challenge your staff in your emergency operations plan by adding more factors and circumstances as the scenario's timeline progresses.
So you're basically challenging people to react to a circumstance and then think on their feet.
Right. Then after the facility's initial response, the exercise director will have what's called injects for the exercise. These injects are changes to the scenario that challenge your staff's training and cause new actions by the participants.
All right, so we have a scenario that involves a power outage. What happens next?
Initially, you have an outage and respond accordingly. Then about a half hour later, you would add an inject. The inject would be like a staff member reports seeing sparks coming from the transformer, and they call 911. The local fire department reports the transformer blew and caused the outage. But they think it's possible that this caused an electrical surge into the building. Such a surge could damage the entire wiring system of the building, and use of the generator could cause a fire. The fire department orders the generator turned off until the electrical and wiring can be inspected and deemed safe. With this latest information, the person in charge calls a meeting of key staff for the exercise. They look at this new situation and create new priorities, adjust responsibilities accordingly, and set new timeframes for accomplishment. In this scenario, without any power and a risk of fire, the decision would be made to evacuate the facility. This would activate the facility's evacuation protocols.
Do all facilities have evacuation protocols and procedures?
It should be part of their emergency operations plans.
What will happen now that the evacuation procedures are underway?
As part of any evacuation plan, the facility should contact the local medical health operational area coordinator, or MOOC, who will help coordinate the evacuation of their residents and their transportation needs.
Anyone else?
Additional calls will go out to state licensing and certification, the Ombudsman's Office, and the local Office of Emergency Services. Once that is done, assignments should be given to staff, and then the task of safely evacuating residents will be in full swing.
From a practical standpoint, what elements does that involve?
Well, they must set up an evacuation staging area, collect medical information that accompanies each resident, and prepare them for transport. There's more behind the scenes as well, and while that is going on, other staff continue to coordinate the evacuation.
What else needs to be happening for this to go smoothly?
Staff will need to ensure that the receiving facility can provide care for evacuating residents. They need to determine transportation type and the amount of transport needed, decide and collect everything the residents need. They will need to implement resident and staff tracking procedures and determine if staff will need to accompany the residents.
That's a lot to accomplish in a short amount of time. How does the facility make sure it gets done, especially with all the variables?
Yeah, well, this is why we do these exercises. We want to expose the staff to what it would be like in an actual event. Situations like these are stressful, they're unpredictable, they create a lot of pressure. By practicing the procedures that we have in our emergency operations plan, the staff will be better prepared when the real thing happens. Plus, we get the added benefit of identifying gaps and deficiencies in our existing plans, and we can go from there.
How are you able to find all these gaps and deficiencies?
Well, right after the exercise play stops, you should gather all the participants together and along with evaluators for a quick debriefing. This is also called a hot wash. During that time, you'll want to ask questions about the overall exercise. What went well? What didn't go so well? Did we meet our goals and objectives? Things like that. It's extremely important to record the comments from this meeting, as they will be critical when you come time to do your after-action report.
Tell me more about the after-action report.
So this is the last element to the entire process. This report is a consolidation of the information gathered during the exercise. It reports out if the goals and objectives were met. It will also include an improvement plan, and this identifies any actions that need to be taken to address the gaps and deficiencies. Each action is then given a due date for completion, along with the person or group responsible for completing the action.
Great. Is there a follow-up?
There is. There should be a report that you generate, and that should be shared with any partners who took part in the exercise and made available for staff and particularly surveyors to review. As you can see, the exercise is a multi-step process. Each element and the steps within are far more detailed, and this was just an overview. Although it may be a lot of work, the benefits of conducting a full-scale exercise have incredible value. Exercises will evaluate emergency programs, identify deficiencies and gaps, while improving coordination with your partners. You'll be able to assess capabilities of resources and increase awareness and understanding of your hazards.
Thank you very much, Jason.
Thanks very much for having me, Deborah.
Hopefully, this information will help everybody be better prepared for an emergency and keep residents safe. This has been On Target, a video series where we discuss long-term care issues. Thanks for joining us.